Health Today, a podcast by Triad Behavioral Health, where we cover trending topics in behavioral and mental health. This podcast is designed to share unique and relevant topics occurring within the world, our communities, and bring them a mental health perspective.
I'm your host, Mike Palmer, today, and joining me is Dr. Graham Taylor, Chief Learning Officer, Triad Behavioral Health. Graham's also a clinical psychologist with experience in hospitals, private practice, and test prep for the past 25 years. He's also a wonderful conversationalist who's got a wealth of knowledge to bring to our audience. Graham, welcome to today's show.
Mike, always nice to be with you. Thanks for having me.
Yeah, and we wanted to talk about health psychology.
Yes.
And we wanted to talk about that topic for a number of reasons, but I think one of them is that more broadly, there's been a trend around self-care and taking good care of yourself and understanding how behavioral health really drive well-being.
Yes.
I'd love to hear more from you, who, from my perspective, seems like you sort of are living a healthy lifestyle, and that health psychology in some ways sort of dovetails with this movement towards taking better care of ourselves. I'd love to hear your sort of introductory thoughts about health psychology, and then I think we'll dive more deeply into the ins and outs for aspiring mental health professionals.
Yeah, well, you're on point when you're talking about there being a mind-body connection. You know, we always hear about that, but it is really real, and we're able to measure it, and we're able to, in measuring it, be able to understand it such that we can come in and provide some education and recognize that there are a number of things in our lives that we can influence and be in control of. There's a number of things we can't be in control of in life, but one of my philosophies is if you can identify those things in life that you can control and seize control over those, chances are, more times than not, things are going to go pretty well. So when we talk about health psychology, we're talking about a specialty area within the context of mental health, psychology in specific, that focuses on biology and psychology, behavior, and also those social factors that influence our health and also illness. Oftentimes, when we're talking about health psychology, also maybe you hear referred to as medical psychology or behavioral medicine. And these are sometimes used interchangeably with the term health psychology. But those are the ways that we focus: the biology piece, the psychology piece, the behavioral component, and the social factors all coming together to influence health and our illness processes.
Mm-hmm. And it is interesting when you think about behavioral health, mental health, frequently there are conversations about the stigma associated with it. Mm-hmm. It is interesting just in terms of the language of health psychology.
Yes.
In some ways, it seems like a reframing of the behavioral health intervention as something that is more focused on the positive aspects of
Yes.
the whole person.
Yeah.
I'd love to hear you talk a little more about that.
Yeah, that's really a nice catch. You know, there are some stigmas around mental health. We're still working to remove those because, you know, we're physical, we're mental or emotional, if you will, and we're also spiritual. So those are the aspects of our lives that really kind of govern the healthy functioning of one's being. But the mental health piece oftentimes doesn't get a clear understanding, and therefore some of the stereotypes and some of the fears around it get kicked up. So when we have the title health psychology, I think you're right. It makes it a little bit more palatable for some.
Mm-hmm, mm-hmm.
And what they learn is that health psychologists come in to complement typically a medical practice, or, you know, a hospital-based practice, or other practitioners that are dealing with the physical part or the medical part of someone's life. And we use psychological science to help promote health, to help them prevent illness, and also in a larger way, help improve healthcare systems. And we use these opportunities to educate and inform patients and other practitioners so that they can take control, or they can help their patients take control of their health.
Mm-hmm.
So most importantly around this is that we know that the leading causes of death at this point are pretty preventable to a large degree. Things like cardiovascular disease, or diabetes, or COPD, and other types of chronic illnesses. These are all things that health psychologists can come in and either help prevent at the beginning, or help treat by making health and lifestyle changes that are very doable, but oftentimes people don't realize.
It just seems like it incorporates a broader
Yep.
context in how you might
Yes,
solve the behavioral problems, the mental health problems that people have.
that's
Um,
right.
how is health psychology unique within the psychology field?
Well, I think the health psychologists really typically, tend to have a real interest in just health in general. And they have maybe a liking for some of the medical practices that they've been exposed to throughout their life. But health psychologists, given their education and their training, are really good at linking people's emotions to their behaviors and helping people really identify the preventable consequences in their life. And we get to help patients, as I mentioned earlier, manage their chronic diseases.
Mm,
We get to help them avoid maybe preventable diseases by incorporating psychological theory and research to help develop methods to assist patients in maintaining these healthy lifestyles from a very early age. And so health psychologists coming in a unique way within the psychological field are really experts in this intersection of health and behavior, where you started us today. And more, they're in demand as part of an integrated healthcare delivery system.
mm. And how does that relate to the training of health psychologists? How are they, if someone is interested in that and they want to specialize within behavioral health
Mhm.
in the field of health psychology, how are you trained? I imagine, it sounds like it's team-based at times, and there's a lot of connection to other health professionals who are providing care. I'd love to hear a little more from you around what's involved in the training of a health psychologist.
Yeah, there are some programs now. Psychology is really a wonderful field in that it provides a number of services across multiple parts of our communities, whether it's forensic psychology, somebody going in to deal with law or the legal system, health psychology, what we're talking about today, child psychology, adult psychology, neuropsychology. And so there are a variety, cognitive psychology, research. There are just a number of areas that psychologists that are interested in practicing in this field can have a primary emphasis in there. And there are programs now that have emphasis in health psychology. Back in the day when I was doing it, I was part of a medical program here at Queens Medical Center here where I live,
Mm,
and it's the largest trauma center here in the Pacific Islands. And so I received my training, and then also came back on staff as the health psychologist, staff psychologist, and we were
mm,
on the medical floors dealing with physicians and nurses and exercise physiologists, kind of a multidisciplinary team.
yeah.
And we get to come in a very complementary way and understand problems with I think, a very thorough, very multi-level perspective, not just symptom focused, but other factors that are playing into what the person is dealing with.
Yeah. 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 And then what are some ways that health psychologists come at illness? Like
Mm,
how what's their approach
yeah.
to helping solve some of these problems that you encounter with your patients?
Yeah. Well, I think, health psychologists come at illness with interventions kind of on a continuum. We tend to look at things of what kind of care is going to be necessary here. Is it going to be primary care that's going to be necessary, maybe secondary care, or tertiary care and prevention? When we, let me define those just a little bit. When we determine something to be like a primary prevention, a psychologist might be thinking about ways that they can be proactive before the individual has acquired some of the risk factors. This is typically the walking well population. And some of the strategies in primary prevention include like decreasing risk factors, trying to maybe increase protective factors, and maybe promoting positive behaviors. Things like, healthy eating, immunizations, exercise courses, skills and relationship building. These are all ways to reduce risk factors in a primary prevention focus. If we look at maybe a secondary prevention, this is considered kind of reactive, if you will. It's kind of how we refer to it in the field. And this is after somebody has acquired some of the risk factors, but before the behavior is actually occurred or become chronic. So again, those that are at risk are the ones that typically have the secondary prevention. And strategies like this is involved where we might name and address some of the risk factors. We might teach some risk reduction strategies. So it might
Hmm.
involve, let's say, a psychologist working with a physician to talk about a patient following up with some blood work who are showing some early signs of maybe being pre-diabetic.
Yep.
Maybe their cholesterol is beginning to rise, or their blood pressure is beginning to, give indication that this could become an issue. Or maybe helping people enroll in a weight loss program. And what
Hmm.
we're looking to do in the secondary prevention is try and change the trajectory of where we see people going
Yeah.
early, to name it and try and change that trajectory. And then if those things don't work, then we typically see somebody in a tertiary prevention or tertiary care way. And this is also considered reactive. This is where the interventions are implemented after the problems occurred and possibly may have become chronic, depending on
Got
when
it.
we see them. And so some of the strategies here involve crisis intervention as necessary and in kind of a must respond way because things are becoming critical. Maybe some examples around this might be an individual who may be put on medication to control their high blood pressure or their cholesterol or maybe their diabetes. What we're looking to do here is to look to lessen the effects of the process that have already started in the patient's life and try and ideally maybe to prevent a reoccurrence,
Hmm.
maybe prevent further complications, and ideally, and most importantly, try and improve the quality of their life. So if we can take our knowledge as health psychologists of the mind and the body and use these things to understand and help individuals cope better, we get to help them manage their pain and essentially learn to empower themselves in their own health, in their own self-care process.
Hmm. Yeah, it's
Yeah.
great. And then I know physicians typically look at problems from a
Mhm.
symptom-based view. How do health psychologists view a person's presenting problem?
I think, we look at the presenting problem as well, kind of a symptom-based way as well, but we tend to look at things from a little bit more holistic perspective, kind of how we're taught, how we tend to see the world. So we tend to look at it from a more holistic perspective regarding their health. And this takes into account not only the person's physical illness and their symptoms, but also their life experiences. So I think, what we get to do is to see any person in their context, not just what's going on physically or emotionally, but what their relationships are like, how much support they may have in their lives, their community,
Hmm.
and how that all fits together to explain and help us understand the person that sitting in front of us. And so the information we tend to collect about the patient includes biological characteristics. This might be genetic predispositions to illness. We might look at things like their behavior that's going on right now, their stress levels, negative thoughts, values, beliefs, and also their social factors. Are there cultural considerations
Hmm.
that maybe unfortunately have led to or maybe maintain some of their illness processes, what their social support is like, and also what some of their relationships are like as well. These are all factors that we know
Hmm.
impact their care. And sometimes when these don't get addressed, these things are going on while we're trying to treat something. And we sometimes experience some frustration because things may not work the way we ideally would like them to.
Yeah. The holistic aspect to the approach
Yes,
is something that's definitely resonating with me. And then you're in some ways trying to get the patient to participate in their care plan, so you're
that's
trying to
right.
get them to follow through on the behaviors that are expected of them and understand the various factors that might take them off the appropriate
Exactly.
path. Yeah.
Yep, exactly. That's well said. Hmm.
Yeah. So what are some settings? It's interesting. You're painting a fascinating picture, maybe partly because you're talking about the Pacific Islands in your specific context, but it sounds like health psychologists work in some varied settings. I'd love you to provide a little more context to what are some of the ways in which health psychologists, some of the places in which health psychologists are delivering their care.
Yeah, well, it's, when I was at Queens, for me, going to work every day was like going to a candy store because there were so many opportunities in the medical center that allow psychology to come in and to be a really well received, very beneficial service that we got to provide, both the staff and also for the patients themselves. So we get to apply, like you're suggesting here, this expertise in health psychology in a number of settings, including we can do it in private practice. I worked at Queens. I did a diabetes group there for a number of years, and I see a couple of those patients still in my private practice now. You can see it in hospitals, primary care programs. You can see it in universities. Corporations have this now,
Mm,
government agencies, and there's some specialty practices such as oncology, pain management. You see
mm.
it in rehabilitation programs as well. And also you see it in smoking cessation programs too. Those are all areas where health psychology is coming in and letting people know that they can really influence their own care in really
Hmm.
positive ways.
Yeah, it's interesting if you think about the other contexts in which people are seeking out coaches
Yeah,
and
exactly.
looking for behavioral help
Hmm.
in like non-professional health psychology contexts. It does seem like there is a growing awareness of what I imagine has been a real significant need for some time, so that when you're in the hospital as a health psychologist, you're really seen as an asset and as filling a need that had been unmet until really health psychology was incorporated into the care plan.
I really like that reference to coaching. And I think it's a nice way to think about it, because when we get to work in multidisciplinary teams, which for me was just always a joy, just always loved it, whether it was other psychologists on the team or registered dietitians, nurses, physicians, exercise physiologists. We even had yoga instructors in one program that I was in. It was awesome. And it was so much fun to work collaborative like that, because each person was an expert in their own field. And together, we really provided some really great things. And we were giving people tools, kind of like the coaching part you just mentioned, where we would give them these tools, help them learn how to incorporate them. You know, it's behavioral change. Change is hard. You know, we're going from one paradigm to another. We've always eaten this way. We've always, done these things in this way. And now we're trying to change behaviors. And oftentimes we say, well, just, stop eating or just stop doing that.
Yeah.
One exercise I like to do with people sometimes when I'm talking about with a group, and I say, how difficult and how uncomfortable change can be, I'll ask the group to simply fold their arms the way they normally fold their arms and hold it for a second. And then I'll ask them to fold their arms the other way. And what you watch is kind of this uncoordinated, kind of clumsy set of efforts to try and get comfortable with folding their arms just the other way and to hold it for a couple of seconds here and just to feel what it's like. And it feels awkward and weird. And that's just folding your arms. Or I'll ask them to fold their hands.
Yeah.
And then to fold their hands another way. And as simple as that sounds, it's a pretty effective way for people to see that behavior change, whether it's folding your arms, folding your hands, changing your eating habits, considering stopping smoking, reducing something, adding exercise into your routine. These are all pretty significant changes in one's lives that require someone to get uncomfortable before these changes actually become more comfortable and familiar.
Yeah.
So, yeah, it's interesting.
Yeah. And it reminds me a little, you're talking about one specific way in which you help your patients make these insights, but how do health psychologists, what treatment modalities do they engage with when they're trying to help their patients follow through on the behavioral change that they want to commit to? It sounds, the example of how they naturally fold their arms, and that was one example. Are there other examples around the treatment modalities that a health psychologist might incorporate into their patient's treatment?
There are several things. One, when you're coming in and dealing with somebody, any one of us, we're always typically in one or so of the 5 stages of change when we need to change something. There are 5 researched stages of change: pre-contemplative, contemplative, planning, action, and maintenance. Those are the stages going from bottom to top, if you will. And each one of these stages has a specific developmental task towards change. And sometimes, we come in and see a patient for an intake, and we might review the lab work or the test results that we have, and we see and then listen to the presenting problem that gets shared. And we can find ourselves prescribing a treatment and jumping right in before we fully understand what may be going on from the patient, from what you referenced earlier as being that holistic perspective.
Yeah.
And we might be prescribing something when they're at a different level of readiness to change. And so there's going to be a miss. And what happens sometimes is we say, well, let's get going on that change. And we're all pumped and we're all excited and we know what it's like on the other side. But someone's saying, you know what? I don't know if I want to start exercising yet, or I don't know if I've got the support to take me down to that place to get a different menu for my lunch or whatever it may be. And so we begin to miss, and the frustration gets to build sometimes on both the practitioners and also the patient side. So where health psychologists come into play is really, with consultation and educating the physicians and their colleagues, is where the patient is at and what the best and next right step, really is going to be. And in some settings, you might just say, you know what, you don't have to change anything yet. Let's just keep talking about this together. And I'll send you a couple of research articles so you can increase your understanding of what we're dealing with here. Right. And we start from a very, very foundational piece. And then we can trust, if I can do that, I can build the next step. And I'll do whatever developmental tasks are right there. All the while I'm doing that, I'm developing and establishing a really solid, trusting working relationship with them, and then helping them move upwards in a better trajectory towards a healthy lifestyle.
Yeah. Wow. It's fascinating. It's applicable for folks who are not necessarily being prescribed health psychology. A lot of what you're describing just sounds like these services would just be fantastic for us in our lives. I would like to hear maybe more as we get close to time, other experiences you've had as a health psychologist, and any recommendations you might have, as we approach the end of our time for today on this topic, any other recommendations you might have for folks who are curious about whether pursuing the training and certification necessary to be a health psychologist is right for them?
Yeah, I think health psychology is one of my most enjoyable times professionally. I was trained in biofeedback back in the day, and we got to take biofeedback that really just measures those things in our bodies that we can measure, whether it's our heart rate or blood pressure or skin temperature, et cetera.
Mm.
And we were able to address things like stress management, anxiety, migraine headaches that get triggered by muscle tension and stress.
Mm.
When I worked at Tripler Army Medical Center here in the islands, we were focusing on secondary prevention, and we saw active duty individuals that were at risk for obesity, and they were prescribed weight loss, but it was very, very difficult for them. And what was happening is that these folks, very, very competent soldiers, weren't passing some of their physical fitness tests. And this was putting them, in terms of their advancement or their careers, it was putting them at risk. And so we had a really effective weight loss program up there that one of the health psychologists, the head of the department, Dr. Ray Folan, had developed. And it was very effective and very well referred to, and had some great effects, saved the military and kept people in their professions, and really allowed some good things to happen.
Mm-hmm.
When I was at Queens, I got to be a part of a number of programs there. One was a cardiac wellness program. We had nurses and dietitians. We had yoga instructors that I mentioned before. We had some great physicians, and I was a psychologist on the team. And we took a holistic approach with each patient, and also included them in group sessions for support and also relationship building. I was part of the diabetes program there as well, part of the COPD program also. And we got to come in and do some real good coaching, like you said earlier.
Mm-hmm.
That gave tools, gave understanding, and letting people really know just how empowered they can be in their own self-care. And it changes it from, I'm kind of a patient and maybe feeling like I'm not too empowered here around some of the symptoms that I'm feeling, and feeling kind of helpless and powerless, to, wait a minute, there are a number of things that I can do. And if I can focus on these things, I can begin to change the course at a root level, foundational level, of some of these things that I'm experiencing. It's been just a really great experience, and I love this field. And I would encourage people to take a look at it if they have an interest, kind of in the health component of their own lives and lives of others.
Yeah, and it does sound, I was thinking about this as you were speaking too, it does sound like it is a healthy and fulfilling career path within the broader behavioral health field as well, where, the aspects of being a collaborative member of a cross-functional team,
Yes.
and then also being a coach who is sort of hands-on to a certain extent around seeing the behavioral change that needs to happen within these people you're working with. It just sounds like a very healthy, I guess that's why it's called health psychology, but it seems like it's healthy for the practitioner as well.
I think it is. I think it encourages, doing right things and enjoying your own health, and, what you're teaching, you better be doing. You can't be the one that teaches without doing. So that's just hypocritical. But what you're also saying right there, and the emphasis in that, is when you think about it, and if we can come in as health psychologists and contribute, we get to affect things, not just in the patient's life, but also reduced healthcare costs, earlier discharge from after admissions, maybe a better and shorter recovery following surgery.
Yeah.
All of these things begin to ripple out from those early interventions that psychologists can bring in. And those are significant additional benefits at a cost level, financial level, recovery level, less pain level, et cetera. All these things we can come in with and do as health psychologists that contribute on a multiple number of levels with people that really help benefit them.
Yeah, as the great one, Wayne Gretzky, once said, you want to skate to where the puck is going. It does feel like health psychology, the puck may be heading in this direction, as a lot of these parallel trends are sort of showing more growth in this area. And it's nice to hear that's also fulfilling. Any final thoughts as we wrap up here, Graham? Also, always a pleasure to get your perspective on this stuff. Folks who enjoy this, we're pushing these shows out every week. We'd love to get your feedback, subscribe, tell a friend, all those great things. But any final thoughts as we start to wrap up on health psychology today?
Well, I appreciate that opportunity just to be here and talk about this one really enjoyable aspect of psychology. I think they're all enjoyable. Just going to find out what your niche is and really kind of where the puck is for you to go, to skate to. And health psychology gets to be one of those that really brings some wonderful tools, some wonderful research, some wonderful science that really incorporates the whole person. And I think psychology tends to come at that in general anyway, but more times than not, we may not include the medical part of it as much as we normally do. Let's say in clinical practice when I'm seeing a couple.
Yeah.
But when I'm coming in this field, I get to have the whole person in front of me, and I get to bring a perspective both to that person and also to those working with them that I think makes a very unique contribution. So I would encourage folks to take a look at it, do some research, and TRAD's always a great resource for people to contact if they have any further questions about it.
Awesome. Thanks so much again, Graham, for your time today and always on the podcast. And thanks again to our listeners for listening. We'll be back again soon on Behavioral Health Today.
Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.